Thank you so much. First of all, thanks for having me. It's a great pleasure to be here. I'll just give a little bit of an introduction to myself. As Jan mentioned, I'm a freelance science writer and journalist, as well as being a freelance global health consultant. Also a member of the European Commission's Advisory Committee on Public Health Emergencies. That's very new, so I can't really talk about that at the moment. I've only really had one meeting. So this year, I got a award for reporting fellowship from the International Center for Journalists to cover health innovation. And being someone who likes to subvert the brief, I decided to look at innovation through a multi-dimensional lens. That is to say, not really looking at sort of blockbuster drugs, but innovation that requires multiple sort of components, actors, sectors, and disciplines to come together. And the Paris Olympics was actually a nice case to explore that. So this is the article I produced, published in the BMJ over the summer, and it really sort of details how Paris was looking to prepare for some of the health threats that will be posed by having Summer Olympic Games in the city. Health threats from mass gathering events are really nothing new. And this sort of includes individual threats to athletes and collective threats to sort of visitors, spectators. So there's a whole sort of body of literature and research agenda around mass gathering events and sort of some of the health threats behind that. And also some of the more notable sort of instances of where we've had infectious disease outbreaks during some of these Olympic events. Zika in Brazil was a sort of quite noted example, and also the Tokyo Olympics in 2020 under sort of the umbrella of COVID-19 pandemic was really a good test case for how to do some of that infectious disease strategy and surveillance during Olympic Games. But more and more, there's the added notion of heat, which I'm going to talk about a little bit about. So this problem of heat, particularly during the summer months, and the headline sort of is that most cities now will soon be too hot to host the Summer Olympic Games. And this is data from a recent paper, I think in Lancet, where they looked at several cities, particularly in the global, in the Northern Hemisphere, and sort of measured heat stress. So it's a combination of temperature, humidity, heat radiation, and wind, and found that already most cities are at high risk for heat stress related to these combination of factors. And certainly there have been noted examples in previous years in 2007, 2016. Jan, you might have been there in Chicago in 2007 when some of those, we saw some of those impacts of heat, particularly on athletes. So as a way to visualize heat and what climate change is doing to sort of cities. This is some imagery from CNRS in France, looking at sort of, on the left, it's a panel of cities across Europe, and on the right is sort of in 2050, what those cities will feel like in terms of the climate. So London is predicted to have a climate of looking closer to Barcelona, and Paris is looking to have a climate closer to Istanbul. So there's a really marked shift in sort of how these cities are going to experience sort of heat and climate change. So I'm not going to go too much into this, but just to say that, just to underscore that there are significant impacts for the body itself in terms of heat, and particularly during sort of training for Olympic events, there are ways for athletes to sort of adapt to some of these measures. But obviously, the question is how much. What are the limits of that adaptation, and what are the limits of the sort of heat that athletes can withstand? So the question around Paris and why sort of the Paris Olympic Games was slightly different was this ambition of Paris to make the entire city a stadium. So you had events across many of the city's famous landmarks, and this was sort of obviously a challenge because notably during sort of Olympic events, outbreaks during the Olympic events rarely come from Olympic venues, which sort of suggests that the city itself is a much larger factor in how sort of these diseases spread. And one other notable sort of important factor was Paris also wanted to have mass participation events. So opening up some of the games to visitors, tourists, and locals in general. For example, there was a Marathon for All event where they were expected to have 2,000 over 2,000 runners running through the streets of Paris. So what Paris did specifically, I sort of aligned around two axes. So the Paris Olympic Committee told me that they sort of integrated risk of heat wave and other sort of health threats integrated into their planning right from the very start. And as I said, these are sort of along two axes: preparation and adaptation. So, for example, for preparation, Météo France was really embedded into the game's main operating center and sort of provided advanced forecasting for some of the heat-related threats that they were going to expected to witness. And adaptation, sometimes we think of sort of innovation in adaptation as sort of fancy, but sometimes it's quite simple. So, for example, the marathon for everyone, they simply ran it at night where temperatures were going to be a lot cooler. And all of this is important because, particularly when we look at France, in 2003, there was a deadly heat wave where over sort of 150,000 people died in a short 2-week period. And so in my article, I quoted Jan as one of the experts, and he really mentioned sort of the need to link surveillance to health promotion. And I think we've seen in the wake of the 2003 heat wave, a lot more work has been gone into sort of promoting how people deal with heat, particularly during the summer months. However, and this is data from a recent paper in Nature, sort of looking at to see if, or at least calling to question some of the heat adaptation plans that particularly European cities may have. So what is the more important is the graph on the right, graph B, and you see in 2002, there's an estimated 60,000 heat-related deaths. And that was compared to, and I think it was in 2003, where there were roughly 70,000 heat-related deaths. So in the sort of 20 years in between that heat wave and 2022 finding, the researchers are calling into question how much progress has really been made if we're still seeing a lot of these increased mortality due to heat. Which sort of leads us to talk about dengue. And of course, if you see, as you can see, everyone's using this ECDC data, which sort of gives proof to its sort of ease of use and sort of very good data behind it. So for dengue, it was on the September 19th in 2023 that a 36-year-old woman from a city around 15 kilometers south of Paris was admitted to the emergency room in a hospital in the south of Paris. So that's a hospital on the left there. And she had sort of symptoms of fever, malaise, headache, sort of very sort of common symptoms that you might see. Blood tests sort of later revealed and confirmed that it was in fact dengue. But what was unique about this case was that the woman had no history of travel from abroad or to other regions of France. So I think that really, as the sort of the ECDC data shows, that dengue is really, and sort of the invasive mosquito is really sort of embedded in much of Europe now. And the question is really around sort of, as Jan mentioned, what are the strategies are we going to put in place to combat some of that? So it's a little bit of a messy slide, but there was a piece in the Guardian, if you see on the left there, there was a case of dengue, case of case of Zika, sorry, in Paris, and the health authorities fumigated a large sort of area around where that case, the person lived. And the question, perhaps me to sort of the experts in the room, is are these sort of tangible, efficient strategies for combating the tiger mosquitoes, particularly when we know that it's sort of very, very much embedded and endemic across much of France. And on the right is they tell you never to read the comments below your own article. So this is a comment from my BMJ article from Dr. Mark Booth, but he brings up a point around how the cycle of the mosquito, particularly around laying eggs, and how the ease of the virus passing from mother to eggs, and all these different sort of internal dynamics of the mosquito can really make it sort of very easy for one case to spread to become thousands. And he makes the point around how this is his piece in the conversation, asking if the Paris Olympics could really become a super spreader event for dengue. And I think the jury and the data is still out on that. But for the moment, we haven't seen much in terms of a spike in number of cases and infected. But I think the point is really around tying in some of these different disciplines and different sort of ways of looking at the same problem, which is sort of the crux of my article in BAG was really around how Paris was using urban renewal and particularly the Olympic Games as a way to spur on some of its green agenda. So I'm not sure if some of you know, the Paris has a sort of socialist mayor, and she's really since sort of COP21 in Paris, the city has really embraced sort of green and very climate friendly agenda, and they've used, as many other cities have in the past, sort of having an Olympic Games to sort of boost investment and to really target that investment around some of these green agendas. And sort of my penultimate slide is to really ask the question, what does adaptation look like? And I think we'll hear later today sort of questions around awareness, not just from the general public, but sort of from the medical community. There was a piece around Belgium having a province in Belgium looking for a climate change doctor, sort of putting an ad out for a climate doctor. So more and more our medical trained physicians will need to be able to be more aware of particularly these infectious disease threats, dengue, particularly since some of the symptoms are quite common. And the picture on the right is from my holiday where I was in the south of France. And this is sort of a vast array of personal sort of protective sprays against the mosquito. And I'm not sure how efficient some of these are, but again, it's sort of to point towards how we'll need a lot of different tools in our belt for some of these big challenges. And finally, just to thank Coalition for Life Pulse Immunization for the invitation, the BAJ for the article, and the International Center for Journalists for the funding for this work. Thank you very much.